Hey everyone, welcome back to Clinical Physio with me, Khalid Maidan. In today's video, we're going to be covering some of the last aspects of your subjective assessment, which would be perceptions, expectations, and goals. Let's start with perceptions. So in terms of perceptions, you want to ask what your patient thinks is wrong with them. Does their health beliefs affect their management? Because it might well do. For example, if they believe that they may have spinal cancer when they come in reporting lumbar spine pain, educating your patient as to why this is unlikely may be important in improving their confidence and their compliance going forwards. In fact, it may be more important than any treatment in terms of exercises that you give them. Next, expectations. Discussing your patient's expectations is important to see if they are realistic. For example, expecting pain-free symptoms with a full range of movement for a severe osteoarthritic hip may well be a genuine patient goal, but is unrealistic. And if this is left unaddressed, could lead to frustration and low mood when your patient hasn't achieved their goals. Alternatively, patients may expect that nothing can be done to help them, when actually there are several treatment options which are available to them. Finally, on to setting goals. Setting short-term and long-term goals will focus a direction for your treatment program and will also focus your patient's mindset towards their rehabilitation. Make sure your patient's goals are SMART, which stands for specific, measurable, achievable, realistic, and time-based. Make sure your patient is at the heart of their goals and try and let them create the goal rather than you create it for them. After all, it is they who will be the one who needs to commit to the goal. And that completes our video. Thank you as always for watching, and we hope to see you again soon, right here on Clinical Physio.